My name is Jessica Chacon. I'm an assistant professor at Texas Tech University Health Science Center at the Paula Foster School of Medicine. I teach immunology and microbiology primarily to first and second year students. But since the pandemic has happened in March, I also developed an elective for our fourth year students as well. I'm a native El Pasoan, so when the pandemic hit, it hit home, literally. I wanted to do something to help our community. And I know that our medical students were feeling the urge to help out as well. So we developed this COVID-19 educational platform. Back in May, we officially launched in July. I'm going to share my screen to let you know where we have come. So we officially launched in July of this year. We've presented to over 1,200 El Pasoans. Our school has definitely been supportive of our initiative. So this is a story that Texas Tech recently posted about us. We have a web page that you can go to, and you can get to it, COVID-19 Virtual Health Fairs. This is a logo that was developed by one of our second year medical students. Our name is officially El Paso Health Education and Awareness Team. So on our webpage, we have a list of events coming up. So we are going to partner with the Sled Independent School Districts on the 14th to present our entire health fair, which is 3 hours long, and we cover overview, testing, home care tips, kids versus adults, mental health aspects, and how to make homemade masks at home. We're also partnering with UT Austin for a panel if you're interested with that. We're going to cover the topics of testing, overview, and mental health. UT Austin will cover the vaccine development, clinical trial development, and the neurology of COVID-19. Our students have also developed pamphlets, which are available in English and Spanish. We've been so successful because we are student-driven. So everything that is created comes out of our platform, is developed by our medical students. I will stop sharing my screen. I will then introduce our panelists. Aaron, if you want to go ahead and share your screen. Okay, we're able to see it. So what are we going to talk about today? Today we're going to talk about COVID fatigue. We can go to the next slide. We actually are going to have our students, our medical students, be panelists for today. So our students are Jacqueline, Shravya, Emily, Amr, and Aaron. So with that, I will hand over the virtual mic to our students to present this panel for today.
Thank you very much for that introduction, Dr. Chacon. So my name is Emily Bateman. I am a first-year medical student. I'm one of the first-year medical students on the panel today. And so I will be talking about COVID-19 fatigue or pandemic fatigue, and I'll kind of be using those terms interchangeably. So Aaron, you can go to the next slide.
I just want to make sure. So I have on my side, it has like the boxes with everyone's name. Is that showing up? Is that blocking?
No, I only have the title slide open right now.
Okay, I just wanted to make sure.
All right, yeah, so that's me. And then Aaron and Shravya, Jacqueline are also there. Amar's picture is not on there yet, but. All right, so COVID-19 fatigue or pandemic fatigue. I like to think of it in the most basic terms as, kind of being fed up or tired of all of this, or like, why can't it be back to normal? And all of those feelings kind of combined are COVID fatigue or pandemic fatigue. And so it stems from a couple of different things. So the first one that I want to talk about is just with any kind of health-related behavior change. So, especially with this pandemic, it's masks or hand washing, but even in most general terms, like exercising or eating fruits and vegetables, there tends to be a relapse in health habits whenever you're trying to make that change. And so in this pandemic specifically, it seems to come down to thoughts of what are the chances I'll get sick? Or if I do get sick, it can't be that bad. And those thoughts tend to compound into that relapse of behaviors, as well as just the mental component of being tired of it. Like, if it can't be that bad, then why am I so stressed? So if you combine this with feelings of loneliness and isolation, which I know a lot of us have been experiencing with this quarantine and this pandemic period, you know, it's super common and very normal, and virtual alternatives are different to say the least. But many reminisce, including myself, and want things to return to normal. Like, I want to be able to go out to dinner with my partner and meet my classmates in person, or go out to a bar and grab a drink. And especially family gatherings. I miss my family. But we have new social norms, and it can be really easy to fall back into our pre-pandemic habits when we see family or friends who aren't wearing masks or who aren't social distancing. So why is pandemic fatigue so important to talk about? Especially with El Paso's dramatic increase in COVID cases over the past few weeks. Although everyone is tired of it, we still have to be vigilant. If we let our guard down, it risks the safety of ourselves, but also our friends and our families who we want to make sure stay safe during this. So that's why we're going to talk about some different ways of going through this today. With all of that being said, I'd like to open this up for a little bit to our audience and ask about your own experiences with COVID-19 fatigue, so that we can better support each other. So would anyone like to unmute and share your story?
I will go ahead and unmute the audience. I can start. So I moved here a little over a year ago. It's been almost 15 years since I've lived in El Paso, and my irony is that I moved to El Paso to be closer to family, and this entire year I've had to social distance from family, so I can definitely relate. I like having deadlines, and not knowing when the pandemic is going to end is kind of driving me a bit insane, because we can't say on December 31st this is going to end, because then that'll make me look forward to December 31st, because then things will go back to normal. But not knowing when the pandemic is going to end, it's driving me a bit crazy. That's my experience.
Yes, I completely feel that. I think that lack of control really hurts when we're trying to go through this stressful period of time. So thank you, Dr. Chacon, for sharing your story. Does anyone else want to contribute?
I know I miss going to the grocery store. Just I don't know. I always like going and buying fresh produce, and now I only go once a week instead of several times a week. Also miss the gyms. If I have to do one more at home body weight, whatever, it's gonna drive me insane.
I'm not originally from El Paso, and when I first moved to El Paso, I had scheduled sort of my flights to go home for after my exams. And after my first medical school exam, my mom called me, and I actually found out that my whole family had been infected with COVID. So it was really hard for me after that first exam not being able to go home. Um, for obvious reasons, I didn't want to expose myself, and coming from a med school and then going home, seeing family who had been exposed or were already infected, I knew it wasn't smart. And it was so hard for me at that time, taking a big test, looking forward to see family that I hadn't seen in a few months in starting school, and then not being able to see them was very hard. And I still haven't seen my family because my dad was testing positive up until about a week ago. So the transition from starting medical school in a pandemic to having family members infected and not being able to see them or even be near them has been really hard. But I do think having a support system, even if it's virtual, has been helpful. A lot of my classmates heard what I was going through and reached out to me and kind of became my family virtually. So that was very nice, even though it's been rough. I think one thing that we all need to remember is to be there for each other, whether someone's going through something or not, just reaching out to them, asking them how they're doing, it's very important, and it really does help with COVID fatigue and everything that, emotions that we're all going through.
Yeah. Sorry. But like Jacqueline and a lot of the other MS ones, I moved here like 4 months ago and didn't know anybody in El Paso. Before all this happened, I was excited to meet everyone, my classmates, and get to explore El Paso. But then obviously, given the circumstances, we couldn't. But luckily, I do have 2 roommates, so that's helped a lot, and just having a support system, and also just like a lot of FaceTiming my family and friends. But even with that, like there is still tough days for sure.
Yeah, I agree. Just to add a little bit. So I'm Amr, fourth year medical student. Sorry, I'm having trouble with my camera. I can't turn it on right now, but trust me, you don't want to see me anyways. But I have 2 kids at home, and honestly, every day that I go to rotations, I'm constantly worrying about bringing it home. And at the same time, I have my 2 elderly parents. My mom's 70, my dad's 75, with a lot of comorbidities that are just they probably wouldn't be able to handle COVID if they were to get infected. And so that's always a daily stressor for me. But honestly, being a part of the EP Heat team and having them as support, and usually I present the coping the coping with stress during the pandemic health fair group. And that, honestly, talking to other individuals about it and just kind of venting and showing others how to cope makes it a lot easier. It's always hard to listen to your own advice, but once you do it for a lot of times, it eventually you get to the point where you're like, maybe I should listen to my own advice and start doing these coping, strategies like meditation and actually having a good support group.
Thank you to our panelists for sharing your experiences with COVID fatigue. I know it's been a very difficult time, to say the least. Does anyone else from our audience want to share their stories? And if you don't feel comfortable speaking up too, you're always welcome to use the chat.
Well, I'd like to chime in, Emily, if you don't mind. At the moment, my family and I are revisiting, whether we will be together for Thanksgiving. And so we have made that decision that none of our children will come home for Thanksgiving. And that's been a really hard one to take, because we haven't seen them for, months since the pandemic began. And I just feel so strongly that I don't want them to come to El Paso at the, especially right now with our numbers increasing. And so I can start feeling sorry for myself, but then I listen to my students and all the things that they're going through, and they're just still like you all on this panel. You're still there. You're still going through your coursework. You're still pressing forward. And that is so inspiring. And I just want to say thank you, because you all are keeping a lot of us going. So thank you.
Thank you for sharing that, Dr. Golding. Especially with the holidays coming up, this was something that my family and I, when COVID first hit, or we first got news of it, and so I'm originally from Denver, and so Denver basically was open, and then all of a sudden, mid-February, it just shut down. And this was something that my family, I come from a very big family of healthcare professionals, and we were just like, I don't think this is going to be resolved by holiday season. So what do we do? And I know for me, like half of my family is a very strong Catholic family, and we love being together for Christmas. And my grandma is not going to be happy with our answer, but we can't, in good conscience, have all of our family go and visit her and hang out in her house, because it's too scary, and it's going to be a very difficult conversation to have. I know at least that's for my side of the family as well. Does anyone else want to share? I promise I won't bite.
Something I just want to mention, and I say this at all of our health fairs, is that even though we're all isolated, we are all going through this together, and everybody's going through it in their own way. So at every single health fair, every single panel that we have, I have strongly encouraged everybody to practice empathy now more than ever, both for ourselves and for others. So we really appreciate everybody sharing their stories. So thank you for that.
If anyone else would like to share, it would be great. But if not, thank you for those of you who did share. And we are a team, as Dr. Chacon said, and we are just trying to get through all of this together, and we're here to support each other. And thankfully, I think that is the only benefit of being isolated, is that everyone's going through the same exact thing, and we're all struggling with our own versions of it. So yeah, but Aaron, if you wanted to continue on, you are welcome to do so.
Okay, how many times do people start talking and then realize that they haven't unmuted themselves? Okay, how to handle this COVID fatigue? It's an important thing, and certainly it would not be productive to put this off, put this on the back burner, and ignore it. So, what are some ways we can go about mitigating the negative effects of COVID fatigue? Well, we all know we're supposed to be practicing social distancing. Specifically, I prefer the term physical distancing because while it's probably not the safest to be in person with everyone that we want to see, we always have the avenue of phone call and video calls. I know myself since March. I mean, I live with my dog, and I know I'd go crazy if I didn't have my dog. But I don't know if y'all can hear him right now. But I call my parents when I do my evening walks with my dog, and that's not the same as sitting down and having a coffee with someone. But hey, it's something. So there's ways to get creative about interacting with people. If you live with your roommates, you can, and you all are all around each other. That's good to have that human interaction. An important thing, of course, when you're going out in public and you're meeting people, wearing a mask, I'm sure we all know, is both an easy and relatively convenient way we can protect those around us. It's important to address your mental health, and so you can call this number, this 211 number, and speak with mental health professionals. And then, while you're at home, I know I cannot sit here and study from when I wake to when I go to sleep. So I'm trying all sorts of new things. I love to play chess. There's some online tournaments that I've been playing in. So anything to pass the time, right? Painting. If you're like me, and anytime you make some sort of artwork and your immediate objective afterwards is, God, I need to make sure nobody sees this. Well, guess what? Nobody has to see it now, especially. So you can try your hand at some art. Exercising at home, You know, it's convenient. There's some trade-offs, but you can also exercise if you want to go running out at the park or something around your neighborhood. There's that avenue. And then cooking, because I know in March, April, May, everyone pretended like out of nowhere, we had all these artisan bakers on social media. So you can always try your hand at cooking, including myself. Tried several, I guess I don't mean to upset any bakers or chefs, but I guess I tried my hand at several ways of baking different types of bread. None of them were really good, but hey, pass the time. And I got to admit, kneading dough is fun. So you can also enjoy the process more than just the results. And so COVID fatigue comes up because there's only so much time that you can expect someone to be reasonably on their guard about preventing the spread of COVID-19. It's not something that's coming right at you, you know, and looking very menacing. You know, we see numbers on the TV or on the news, and it's easy to see numbers and become desensitized to them and think, well, that's the new normal. So when there's not this imminent threat presenting itself, it's easy to become complacent and become lax about adhering to preventative measures. But it's still important to wash hands, you know, the 20 seconds with soap and water, or use hand sanitizer with the 60% alcohol, at least, wearing the face masks. I know that gets monotonous and boring, and you just have, you know, some black or whatever monochromatic face mask. Personally, I like to wear masks that have designs on them, funny designs. I like to have farm animals on mine. I have one, my favorite one, although I haven't seen it for a while. I think it's probably in the car. It has chihuahuas and a heart on it. So there's that. I like to smile at people when I pass by. Obviously, I can't smile at people with a mask on. So wearing a mask with a funny design maybe is the new way to show people, hey, hope you're having a good day. And then lastly, if you're in an area, maybe you went and walked to the park or something, you're sitting at the bench and suddenly it gets crowded, probably one of the better things you could do is just get out of there. Get away from people. Yeah, you could be outside, and yes, maybe it's less likely to spread when you're outside, but it's still important to be aware of the potential for spread outside, especially if people aren't wearing masks. You know, here are a number of preventative measures that I'm sure we're all well aware of that we can take to limit the spread. And I also just want to kind of close this slide on the fact that going back to the lack of a perceived imminent threat on any of us younger folks, 20s, 30s, teenagers, there does exist a significant threat that maybe one of us becomes infected, hopefully not. And there's a higher chance maybe it'll just be a passing illness for a younger, healthier person. But the risks that are associated with spreading this virus to someone who's older are a lot higher. And I know El Paso, I've been coming here my whole life. I have family here. My family came over from Juarez and came up in El Paso. It's a big family-oriented community. We were talking a little bit about the holidays earlier. We all want to be together. We all want to see our abuelitas, right? But we also need to make sure these are the most vulnerable people in our family, and we need to make sure that we're protecting them. I like to, well, before the new restrictions that have been imposed, I used to go visit, you know, you visit family, you go sit out in the driveway, you're across each other from the driveway. Maybe you bring your own food and you sit out there and have dinner out there. watch the sunset over the mountains, and you're socially distanced, you're outside, you're wearing a mask, and it's, you know, things you can do to lower the risks of spreading and still being able to see the people that you love. So one final note, folks in the audience, you all are the futures of STEM. Y'all are coming up working really hard. I know firsthand experience that learning in a virtual format is really difficult. And it's not the same as being able to sit down in class, engage in dialogues with your professors and classmates. But everyone recognizes the hard work that you're putting in. Everyone recognizes the sacrifices that you're having to make. So I urge y'all to continue on the path that you're on, continue putting in the hard work. And, you know, as future STEM leaders, I encourage y'all to continue being examples of El Paso Strong, showing this community what we need to do to protect our most vulnerable and slow the spread of coronavirus in our community. Thanks.
Thank you so much to the students for the presentation. So Aaron is a second-year student, and he's been with our platform since it first started. And I'm a bit sad because Aaron will be stepping away soon to study for a big exam that second-year medical students have to take. But I'm really happy that we've had Aaron since the beginning. He's become one of our rock star presenters. So I'm glad he's being an indirect mentor for the incoming students that we have. So thank you for that. One thing that I started to try to do during this whole pandemic is I've always been an avid reader. I love it. But I moved a lot over the past 15 years to different cities, different states, and I would have my husband take the big box of books everywhere we went. And this last time he said, if you're gonna lug around your high school chemistry book that you haven't opened in a couple of years, you're gonna have to help me move it. And then when he said that, I said, okay, I can switch to ebooks. I can do the Kindle. So I've been switching to that. And I've also tried audiobooks. So when I have two kids, as many of you know, and I'm always cleaning after them. And so when I'm cleaning, I'm listening to my audiobook and I'm trying the Kindle, something new that I'm doing. I've also tried to exercise, as Aaron was mentioning, but it's tough. And I've had my friends over a group text. We encourage each other. Did you exercise today? Did you do the challenge? But it's hard for me. It's hard. But I remember what I tell everybody in the health fairs, you have to have empathy for yourself as well. So the days that I don't exercise, I'm a bit upset, but I don't just harbor on it all day. I said, okay, tomorrow's a new day. Let's try it out. Those are just some things. And with the mask, one thing that we mentioned in our virtual health fairs is to be creative with your mask, but also a lot of us have younger brothers, younger sisters, children, students. It's important to educate them as well. So we encourage getting them involved with making their own mask, picking out their own mask. My daughter loves llamas, so she has a couple of llama masks. My son loves Mario and Luigi. So every time we go out, they're excited. Where's my llama mask? Where's my Mario mask? And I tell them superheroes wear masks, and now it's our turn to serve as superheroes to protect ourselves and others. So with that, I will hand it back over to the students. Is that it? Do we have anything else? Or are we complete? Does anybody else want to share their experiences from the audience, or?
Also, if there are any questions.
Hi, I just wanted to share a little bit if that's okay.
Please.
So basically, I didn't get a chance to share before, but I was just gonna note, like, I just yesterday I was in an office hour with one of my psychology professors, and there was like a good 20 of us in that room, and there were so many stories. It was literally like, I have COVID and I can't take care of my daughter right now. Is there any way I can get an extension for the exam? Or, you know what, my grandpa just passed away, and obviously, I'm not feeling okay. And, there was just so many different stories. And I feel like my professor as an educator wish that she could have done so much for us, And I feel like as educators, I feel like they really are trying their best at this point for their students. And along with that, it's really is like webinars like this, um the small things matter. So I really just wanted to extend my gratitude for you guys to hold this webinar, and allow us to just kind of share our experiences, and kind of just feel united.
Thank you for that. And I'm glad that you are able to take away that feeling of unity, and we're all in this together from this. And we're happy to put these on so that we can feel a little bit less alone during these trying times. And I'll also add huge shout out to our educators as well. At least my medical school professors have been absolutely fantastic and amazing. And even though everything's online, I still feel like a much more ingrained member of my community than I ever did in like my undergraduate institution.
I certainly know educators all across the country, across the world, have had to adapt on the fly with very little notice. I have an uncle who teaches first grade, and a lot of his class, the kids speak Spanish, and I see pictures of him sitting at his dining room table with his laptop pulled up. Not everybody, one of his students, has a laptop. Maybe they have to call on the phone or something like that. And there he is, making sure that these Spanish-speaking youth or their Spanish-speaking parents are able to stay informed, and that get as good of an education as he can provide, given the circumstances. So the work of educators is also something that's not going unnoticed.
Thank you for that. We definitely appreciate all of the positive feedback. We are trying our best as educators to really provide information to our students, to really engage our students, to connect with them. I miss being in person with the students, and I miss seeing all of the faces. So being the team lead for EP Heat has really helped me bring back that connection with the students that I do miss because of this pandemic. Do we have any other questions or comments from the audience?
Well, Dr. Chacon, I'd just like to ask, and I don't know that this is a fair question, but just given our increase in numbers, do you think we'll still be in the online setting in the summer? And as I say, it's not a fair question.
No, I think it's fair in that we as educators want to know what's happening, as well as the students. It's really unknown right now. So we partner a lot with school districts here in El Paso, And we're partnering with the Saletta Independent School District in a couple of weeks. And I follow the openings of the school and whether they've chosen to extend the online closely, because we need to be informed with our partners. And it seems like they've been taking it day by day, sometimes week by week, really closely monitoring the numbers. And they have a scale, green is good and red is bad. And I just received code red. So it seems like the schools are going to continue online learning as of now. But we're just not sure where the pandemic's going to go. And that's kind of what makes it so frustrating, is that we don't know when it's going to end, and we don't know if it's going to get better. And we thought it was getting better, and then we were hit with this huge wave in El Paso the past 2 weeks, and now we've made national news. So it's so many unknowns right now that we're just not sure, unfortunately.
Thank you for that. It's just nice to try to get a feel for things. My own experience with understanding numbers in different countries is I've watched Australia closely because we have 2 children there, and my husband is Australian, and they've gone to the extent of closing borders, and Victoria, for instance, his home state, is still in not lockdown, but no one can leave Victoria or enter Victoria. So it seems like that is working, and I just wonder if that's something that maybe we should consider. I don't know.
Right, it's tricky, and it's just so crazy. And I say this often, if you think about us last year at this moment, November 5th 2019, we were all getting ready for the holidays, and never in at least my wildest dreams did I ever think we would be in the middle of a pandemic. But I had a meeting with our EP Heat students yesterday, and I told them that during this time it's important to recognize what you can do. And I tell people, you can't control what others do, but you can definitely control what you do in your life and how you keep safe. So I'm really happy that we've taken the initiative to be proactive during this time. It's very easy to just give up hope, to feel very isolated, and it's very hard to really continue to go on every day, try your best. And I told my students yesterday that when we're 70, 80 years old, we look back on our life, we're talking with others about this pandemic, we can think about what we did during this time. What did we do during this time to help our community, to help ourselves, to help our family, to help our friends? So that's why it's important to have this conversation. It's important to keep communication open, especially now. I highly encourage communication because we're all in this together. It's not just El Paso, it's not just Texas or the United States, it's the entire world. So it's important to keep communication open, to ask these questions, to talk about things.
I know I certainly wasn't thinking that we were going to be here last year at this time. And even I think as late as February or January, obviously we didn't have a lot of information about coronavirus at the time, but I remember giving this kind of like snooty response at this student panel. They were asking about coronavirus, and I was like, unless you have the epidemiological risk factors or something really high and mighty like that, I wouldn't be concerned about it. Obviously, we didn't know much at that time, and I think back to that moment a lot, and because it sticks in my mind as a time when expectations were really just not consistent with reality. And I remember them giving initial deadlines for, oh, we'll be back in school by March 31st or something like that, April, halfway through April. And halfway through April came and they said, nope. So one thing that I've been trying to work on is just accepting that a lot of this is out of, a lot of the timeline is out of our control, but the steps that we can take to mitigate the spread and hopefully accelerate a return to normalcy are within our control. So.
Okay, well, I just want to thank our panelists for presenting today. I want to thank all of the attendees for joining us this evening. I want to give a big shout out to Dr. Golding and the Chacon team for allowing us to present today on a very important topic that we're all dealing with right now. I want to encourage everybody to stay safe and to take care.
Thank you so much for having this. It's really wonderful.